Thank you so much for having me, Sue. Yes, these words are hard to pronounce. I had to learn proprioception as well, and I still misspell it sometimes. Dyslexic on top. Ehlers Danlos Syndrome, I always use EDS. It is just simply easier. And the other one is dysautonomia. So really our autonomic nervous system not behaving the way it should, or suboptimally, or doing whatever it wants. And the mast cells, our first defense of the immune system, first line of defense, is really often embedded in the connective tissue. And so what we are looking at here is that connective tissue, nearly 80% of our body, you have the immune system in there, and you have the nervous system ending there, the receptors in the connective tissue, and that's where they all communicate. And so what we are looking into also is this communication between these different systems, because our bodies communicate. I do find our medical systems would need to learn that, but our bodies already do. And so when we are looking at connective tissue and mast cells and the autonomic nervous system, we don't really know what are the mechanisms that link them. How are they correlated? Are they comorbidities? Is this one big thing, or where does it interconnect? And so patients as well as medical professionals have asked us quite often, what do we know? What does the literature say? And we didn't know. And so the amazing Maggie Buckley that Sally already mentioned, patient advocate extraordinaire, lovely, tried pushing me into doing a literature review over years, very lovingly. And so finally, some point, a coalition of physicians from all networks, from the EDS Society, the International Consortium, as well as from the Dysautonomia side and the Mast Cell side, came together. And we did just a scoping review of the literature. And there are other reviews out there as well over the last years, 4. And sadly, what it reveals is that there was not much literature out there, but they were scoping reviews. And so we presented that in Rome at this at the International Scientific Consortium meeting there. And then I do believe it was very much the last day of that conference, and the Queen had sadly passed away on that day, and so nobody could leave back to the UK. And so Sally and I and Maggie sat down together in lovely Rome, in a lovely Italian restaurant over wine and very good pizza, I remember, and said, we have to go deeper into this. And we have to actually do a systematic literature review. We had been working on the guidelines, and I am honored to be working with Sally. She is amazing in everything she's teaching me in how to do these guidelines and these reviews. It is an absolute pleasure to work with her. And so, you know me, I love the planet and languages and cultures, and we said we have to do this globally. Because when you look at it, connective tissue in Eastern medicines, for example, other medical systems, they talk in the first paragraph about connective tissue and mast cells, and you're astounded. And why doesn't biomedicine do that? So we said, we know that, for example, there was already an article out that acupuncture is possible in EDS. EDS has sometimes bleeding issues, and one would think, can we just put needles into everyone? Yes, it was possible in EDS, said that publication. And so we looked into other medical systems, and we see a lot of thoughts about connective tissue, about mast cells, about the autonomic nervous system. And for them, it's quite normal. And so the question we want to answer with this really global systematic review is, what is if any, are there pathophysiological mechanisms between connective tissue disorders, mast cell activation, and dysautonomia, and to do a very thorough, systematic, global literature review to find out what are the different hypotheses out there, because maybe we don't have to invent the wheel anew. If we actually work together as a team on this planet, we could get so much further. And so brainstorm this together. There might be a different word for it, but it's the same concept behind it. We need to find out what is the actual translation, what is the concept, and then we might have different answers and hypotheses upon which we can then actually do further studies. And maybe there are different ways already that exist that we can bring together to help alleviate any symptoms or improve the quality of life of patients living with this. And so we went ahead, got a very global team together. At the moment, the core team covers 24 languages, 12 countries, all medical systems around the globe. So we're going with Ayurveda, traditional Chinese medicine, Unani, naturopathy, Western medicine, anything we can find, so that we can really cover it and find out what are we talking about, because any medical system, we're all treating human beings. So therefore, what is out there? What can we do? With that, we have now gone as far as it is registered in Prospero, so we can do the systematic literature review. We are going to use 18 search databases all around the globe to really look into this. We have translators on the core team. Anything that comes up where we don't have the language, we will get others for it. We are covering mainly all specialties. As you well know, sadly, in Western medicine, there is no specialty for connective tissue. I hope we can change that soon. It covers far too much of the body. And so we are covering all of the specialties, the different specialties in other medical systems, including also veterinary medicine and all allied health professions. Veterinary medicine, especially because there are actually quite a lot of publications out there that look into connective tissue in animals, and they know a lot about it. So in order to find out what can be done, what happens, maybe we know in animals much better what happens in birth with animals that have connective tissue disorders, and maybe there's an answer there that we can study further in human. We don't know what's going on. We need to find out. That is where we are at. And we're hoping to do this within the next year. We've got the group together. We've got the keywords for all languages. We also had to translate. Obviously, this is not only a translation, this is linguistics also at its core. I did study linguistics before I studied medicine, so I like it. But sometimes when you translate something, within medicine here, you have to not only find the same word that translated, but you have to find maybe a concept that might be different. What is not only connective tissue, what is the concept behind it? That might be something very different in traditional Chinese medicine and so forth. So the physicians and healthcare professionals that work in these medical specialties have helped us in conjunction, working together, communicating, explaining it to each other to find the concepts and the words that will then become the keywords and the mesh terms for our database search. Then we are going to, like any systematic review, do the meta-analysis afterwards. We have patient involvement throughout with Maggie Buckley and other patient advocates around the planet, so that we will keep actually doing studies with patients whilst we're looking at the literature to ask them, what do you need us to look for? Is there something that you actually want to know or that is always bothering you? Is there something specific about this? For example, we want them to also look at the document in the end of saying, yes, this is phrased in a way that I would understand, or how does this concept relate, or what is missing, and so forth, so that we can keep doing that whilst we're doing the literature review, so that it is involved. It wants to look at the interrelatedness between the connective tissue, the mast cell activation, and the dysautonomia. So if you look at it from a childbearing point of view, simply the fact that the immune system goes down in pregnancy, it has to. What happens with somebody who has an overactive immune system beforehand? How does that affect? What is happening in the mechanisms beforehand and afterwards? What happens if the connective tissue is, as Sally said, all the relaxing in the body and very nice and smooth muscles, but to be nice to the ligaments, they do a suboptimal job and do not hold the joints together that well. If they keep popping out, what can we do? There are treatments, different ones all over the planet, that at the moment, it is very sad. It depends on where you are on the planet, what access you have to which treatment. That shouldn't ever be. It is more often the case in rare diseases or orphan diseases. This is, as Sally said, we are quite sure, most probably not a rare disease, just underdiagnosed. There is the Ehlers Danlos Syndromes with all its subtypes, 13 currently, the 14th is discussed. There is also Hypermobility Spectrum Disorder, which we're most certain is not rare at all. Professor Rodney Graham, who is one of the pioneers and the great professors in Ehlers Danlos Syndrome, he once told me in 2015 at a congress in Paris, I think, he once told me, well, they did a study and they couldn't publish it. He knew I had been studying opera singing and was an opera stage manager before I went into medicine, and so he told me about this study. They had done a study at ENO or at Covent Garden, I don't remember anymore, but to look into artists and how many artists have EDS, and the answer was 30%. So it is maybe also because this connective tissue is so amazingly sensitive that they can do art, so they do it differently. It's 30%. And he said he couldn't publish it because the control group was the stage managers. And so I said, well, sorry, Rodney, most of the stage managers have studied art before they go into stage management. That's why it wasn't a real control group. But that might be, you know, the numbers that we are looking at when they are not as symptomatic. And so then sometimes we see in about 80% of people that hormonal changes or a big traumatic event makes this house of cards crash. We see often an onset in females during puberty. We see a difference with pregnancy. So what's happening there that is provoking the system to become symptomatic? And then what can we do to roll it back and become their selves, how this body is supposed to be? Because there are quite a lot of amazing things about it. There's an amazing resilience, and being hypermobile per se without bad proprioception. Proprioception is this sixth sense of to know where you are in space. You need that for gymnastics, you need that for ballet, you need it for everything, for walking. But if you have it suboptimally, it's not that much of a problem when you're not hypermobile, but when you're hypermobile, the joints can just pop out. And, you know, if you have perfect proprioception, with hypermobility, you become someone biles, and if the proprioception goes, you might have a problem. And so, yes, we might be looking at many, many more people that have connective tissue disorders and that obviously then are pregnant with it, and we need to take better, different care for them and look more into it. So any help that you can give us with languages or any help is absolutely appreciated. Write to us. We want to look at this globally. Thank you, Sue.